This portion of CardioSource Video News is supported by the makers of Xarelto.
Welcome to ACC 12. I'm Dr. Randy Martin for CardioSource Video News. There was a fascinating, late-breaking clinical trial, and a trial that was just released recently called the STAMPEDE Trial, and I'm honored to have the lead investigator and actually the surgeon involved in this, Dr. Phil Schauer from the Cleveland Clinic. Phil, thanks for joining me.
Thanks, man. Great to be here.
Tell me a little bit about the STAMPEDE Trial.
Yeah, so this was a three-arm randomized controlled trial comparing two types of bariatric surgery with intense medical therapy to treat type 2 diabetes. And the endpoint was tight glycemic control with an A1C of 6% or less.
So, but the important point is that this is a randomized trial, not an,
right.
As I said, we've had observational trials about
there's been observational trials for more than 20 years, Randy, but this is, as far as we know, the first randomized controlled trial comparing surgery with intense medical therapy. Yeah.
And so what did you find?
Yeah, well, the two operations were gastric bypass and sleeve gastrectomy. These are operations done laparoscopically. Patient stays 2 days in the hospital, recovery 2 to 4 weeks. And intense medical therapy was much more than the standard ADA guidelines. I mean, these patients got a lot of medications, and even some of the more potent GLP-1 agonists were used in the study. So at 1 year, we found that there was much better glycemic control in the surgical group. About 42% of the patients who had gastric bypass actually got to the A1C of 6% or less. And they started out at about 9%. So a big drop in their A1C. Similar with the sleeve gastrectomy, 37% reached that target, and about 12% reached that with the intense medical therapy. Now, interestingly, all of the patients with the gastric bypass surgery hit that target without any diabetic medications. And
that's amazing.
About half of them were on insulin prior to surgery. So they weaned off all their insulin, all their oral agents, and reached that normal blood sugar level without medications.
That's absolutely amazing. And tell me if I'm wrong, but I thought that you saw these changes pretty quickly, so it wasn't a weight-related change.
That's the fascinating thing, Randy, because we know weight loss is part of this, but some of these folks are coming in with a fairly high dose of insulin, 50 units or so, 100, and before they leave the hospital after surgery, before they've lost a pound of weight, their blood sugars are dramatically better. Many of them are off their insulin almost instantly.
What's going on? What is it?
Good question.
Is it gastric hormones or something?
Well, we think so, and actually we have a sub-study looking at that within the STAMPEDE study to look at gut hormones and specifically insulin secretion and insulin sensitivity. And several other studies have suggested that gut hormones, namely GLP-1, GIP, PYY, all these alphabet soup peptides made in the distal ileum that are rapidly upregulated and have a potent effect on the beta cell itself.
Phil, how long did you follow these patients? So I mean, obviously these are patients who could benefit from this dramatic reduction, but the question of safety and efficacy of this type of surgery.
That's a real important point, Randy. And this study was the endpoint was 1 year. Of course, we're going to follow them up to 5 years in an extension study, and we do track for adverse events as well as other efficacy points. Not just glycemic control, but other cardiovascular risk factors as well.
As we finish up, what are some of the conclusions? What's the take-home message for the cardiologists, the viewers that are doing this?
Well, I think the take-home message is for patients who are obese, have type 2 diabetes that is not well controlled, where they've tried a variety of medications and their A1C is still floating around 8 or even above 7, that surgery is a reasonable option to consider. Because we all know the consequences of poorly controlled diabetes, devastating in terms of blindness, renal failure, amputation, and then the cardiovascular implications.
I mean, congratulations. It's a fascinating study and a very I think it'll generate a lot of tremendous interest and help us in management of patients. So thanks very much,
Randy,
Phil.
Thank you for the time.
Okay, and thank you all for watching us, and we hope you'll stay tuned because we'll have a lot more information for you here from ACC 12.